Today we're talking about Sucralfate. Some of the trade names for it is Carafate, Orafate, and Prothenol. The mechanism of action, it binds to duodenal, and gastric ulcers and gastric erosion. It provides a buffer for acids, inhibits the action of pepsin, and absorbs bile salts. The therapeutic use is used to treat ulcers and impairments to the mucous membrane lining, as well as gastroesophageal reflux disease.
So the safe dose range for Sucralfate for adults is 1 gram 4 times a day, and for children it's 40 to 80 milligrams per kilogram a day, divided into 4 doses or every 6 hours. One of the diseases that Sucralfate treats is gastroesophageal reflux disease. The pathophysiology of this disease is that it is a syndrome caused by the backward flow of gastroesophageal contents into the esophagus, and it occurs because of inappropriate relaxation of the lower esophageal sphincter in response to an unknown source. So what happens here is in the stomach, the acids here flow backward up into the esophagus because the sphincter that's right here does not close properly.
I'm gonna look at her.
What are some side effects of this medication my father will be taking?
Some of the most common side effects would be constipation, dizziness, and drowsiness, along with diarrhea, dry mouth, and indigestion. Some of the severe ones would be hyperglycemia if he has diabetes.
Okay.
That's just an increase in blood sugar.
Okay.
And anaphylaxis.
What is the most common one?
Constipation.
All right. And what is that anaphylaxis?
It's a severe, life-threatening allergic reaction, or potentially life-threatening. I'm sorry. Some signs and symptoms would be wheezing, shortness of breath, feeling of impending doom, red itchy rash, and chest tightness.
Okay.
We use it cautiously in people who have renal failure, accumulation of aluminum can occur, diabetes. The hyperglycemia can be used with, or can occur if they use the suspension, and impaired swallowing due to tablet aspiration risk.
Okay.
And then it's contraindicated in people who have a hypersensitivity to the ingredients used to make it.
Okay.
So they are less likely to have that anaphylactic reaction.
Right. Are there any interactions with his other medications he could be taking?
Only if he's taking like phenytoin or fat-soluble vitamins.
Okay.
It decreases the absorption. Also in tetracycline.
Okay.
It also decreases the effectiveness when used with antacids, cimetidine or ranitidine. And then it decreases the absorption of fluoroquinolones. You have to separate the administration by at least 2 hours.
Okay.
Some nursing considerations are to assess the allergy to sucralfate, a history of chronic renal failure, or if they are on dialysis, due to the accumulation of aluminum that can occur. We also need to assess their ability to swallow because the Sucralfate tablet can be very large and it increases the risk for choking. We should arrange for regular evaluations of serum creatinine level to measure the glomerular filtration rate. The normal serum creatinine level in men is 0.6 to 1.2 milligrams per deciliter, and in women it should be at 0.5 to 1.1 milligrams per deciliter. Some administration details. It can be administered PO as a tablet or as a suspension. Tablets may be broken or dissolved in water prior to ingestion. We need to give the drug on an empty stomach 1 hour prior to or 2 hours after meals and also at bedtime. You can administer antacids between doses of sucralfate to deal with pain, but not within 30 minutes before or after a dose of sucralfate. You should consult the pharmacist before administering enterally through NG tube due to protein binding properties which may result in the formation of a bezoar, a solid mass of indigestible material that could accumulate and block normal GI function.
Good morning, Billy Ray Cyrus. I have some education on your sucralfate. I'm going to sit you up here. Okay, that looks good. As a nurse I advise you to continue with the course of therapy 4 to 8 weeks, even if you are feeling better, to ensure the ulcers are healing. If the dose is missed, please take it as soon as you remember, unless it's time for your next dose, and do not double dose. Please don't double dose. Advise the patient to increase your fluid intake, your dietary bulk, and exercise to prevent drug-induced constipation. And we emphasize the importance of routine examinations to monitor the progress. So the outcome of this drug that you are taking is going to decrease the abdomen pain and the prevention and healing of the duodenum ulcers seen by x-ray examinations and endoscopy. Do you have any questions? Okay.
Thanks for watching!